Now, Council of Governors had a meeting yesterday, a virtual meeting yesterday, and in yesterday's meeting, they agreed on quite a number of issues. And as we promised before, we shall be issuing a press release for issues to do with county governments every Wednesdays. And that's what we have been doing. The previous two statements, I issued them from my own county. This is the first one I'm issuing from here. So as I had mentioned, we had a virtual meeting yesterday from 2 to around 4. And as a council, we agreed quite a number of issues. We continue to acknowledge the efforts of the national and county governments put in place to contain the spread of the coronavirus. We also commend the citizens who have heeded the call and follow the direction given by the relevant government agencies. It is for the good of all of us, especially this time when we get reports of an increasing number of COVID-19 positive cases. All of us are at risk of contracting the disease and must do our part in this war. Everyone has a duty to stay safe and protect other persons from infection, and therefore we request you to follow the guidance given by our doctors and our agencies. There are many vulnerable people, the aged population, for example, the aged population, young children, and those with underlying medical conditions. As a country, we bear a big HIV and AIDS burden. This may compound our situation should the virus continue to spread. Every individual has a duty to stay safe and protect other persons from infection. We make this appeal to you, cognizant of the fact that millions of Kenyans risk death by starvation should they stay at home without food. We therefore call upon the national government to make arrangements and put in place an economic stimulus intervention for small and micro enterprises to cushion them against the economic impact of the coronavirus. We will today address you on the progress county governments have made, the gaps and challenges identified since the last week, Wednesday, and finally the call for support that we put out today. What we have done so far: 1, ICU beds and ventilators. Currently, only 24 counties have functional ICU facilities. 14 counties of these having benefited under the MES project. The total number of ICU beds in all the counties is only 162. 22 counties do not have ICU facilities. We call upon the national government to support these counties to set up ICU facilities immediately. There are 161 ventilators in all the county ICUs. We need support to acquire approximately 300 more ventilators. On human resource, to address the gaps in human resource, we had the meeting with the national government, and the national government has agreed to support additional staff to counties, 6,656 health workers in different cadres for COVID-19 emergency only. These are not extra staff, but they are only for this particular emergency. And we have agreed that this staff, the counties should start a recruitment process immediately as the national government organizes to release funds for that purpose. On personal protection equipment, PPEs, all 47 counties still has challenges of inadequate PPEs despite the government effort to procure some and get donations from stakeholders. As at 20th March, KEMSA distributed the following assorted PPE items: surgical masks, 694, face masks, 32,000, medical disposal overalls, 910 pieces, field shirts, 735, goggles, 610, examination gloves, 769 boxes of 50 pairs in each, camputs, 140 pairs, N95 masks, 2,000 pieces, and 167 sets of complete PPEs. These have been distributed to various counties. These items, unfortunately, are not readily available in the market. And if they are, the standards are not guaranteed and the prices are prohibitive. Therefore, measures need to be stepped up to procure them in bulk to ensure the country acquires enough stock. This shortage poses a serious challenge of vulnerable of health workers in the response. Testing for COVID-19. Only 2 labs at the national level, at KEMRI, for example, at KEMRI and National Influenza Laboratory are able to test for the virus currently. This is in itself a great risk for the country should the disease spread rapidly in many counties at the same time as is projected in the coming weeks. The national government has agreed to operationalize 5 other labs in the regions. As the Council of Governors, we request that accreditation of regional labs should be fast-tracked and private labs in non-private hospitals such as Aga Khan, Nairobi Hospital, MP Shah, Met Hill, etc., among others. Isolation facilities. Most counties have isolation rooms, and counties have been requested by the national government to expand their capacities. It has been agreed by the National Coordinating Committee that more isolation places be identified in counties. And this could include boarding schools to serve as isolation facilities. Governors have agreed to take up this responsibility and identify these facilities. On community sensitization, communities are being sensitized on the need to adhere to the government guidelines on infection prevention in local vernacular languages and sign languages. Number 7, reduction of electricity tariffs. The Council of Governors has requested the national government to lower electricity tariffs for all medical facilities in the country, and also to request KPLC not to disconnect electricity in case of delay in payment for the next 3 months. Waiver of cess. Number 8, county governments have agreed to waive cess as requested by national government to websites on all foodstuffs and transportation of the same. On supplementary emergency budgets, the county government's supplementary budgets on emergency. The National Treasury is requested to upload the vote of county supplementary budget on emergency on IFMIS with the interim approval of the county budget committees, awaiting ratification by the respective county assemblies. Maybe I will need to explain this. Usually, when we prepare budgets, the budgets have to be approved by the county assemblies, whether it is supplementary or main budget. And because the county assemblies are now on recess for the various reasons you know, we are requesting that this particular approval be obtained from the county budget committees, because these are few people that can be called. They give the approval, pending the approval by the county assemblies. But the approval of the budget committee should be enough to upload that budget on the IFMIS system so that the counties have access to the funds to spend on these emergency issues. Following the agreement between the council and the Kenya Pipeline Company Limited for the supply of 20,000 liters of sanitizers per week, the council will, with effect from today, supply counties with sanitizers as follows. And that's why this committee has been meeting this morning. 1, counties with active confirmed cases will each receive 520 liters per week per county. Category 2 are counties classified as high risk. And these counties classified as high risk will receive 440 liters per week per county. Up to 30th June. This will go on up to 30th June this year. Category 3 are all other counties. All other counties will receive 400 liters per week per county. And category 4, the County of Governors Secretariat will receive 160 liters per week. This distribution might vary as the impact of the spread of the disease changes. But we hope this supply will be there up to 30th June of this year. Finally, as a Council of Governors, we urge all members of the public to remain vigilant at the risk of transmission as the community is higher with more confirmed cases. We ask them to report any suspicious persons who have refused to self-quarantine. We have installed emergency lines in all the 47 counties. Let us utilize them. In fact, they are working. We have been testing on a random basis. We should continue with the precautionary measures, such as maintaining hand washing all the time and keeping social distance. That is what we had for today. Ladies and gentlemen, if there is a question, you are free to ask.